Welcome to Paper Trail. My name is Tony Turner, and I'm the Executive Director of Enrich Advisors, and I'm joining you today via Skype from our corporate offices from the Woodlands, Texas. And today I want to talk to you a little bit about medical necessity. Why is medical necessity so darn important? Well, medical necessity is important if you want to hang on to the revenue that you've been paid for your hard-earned work. And as Medicare has, in their recent report, has shown, there has been a record amount of recoupment dollars being taken back and away from providers after they've been paid. And the RAC auditors are definitely showing a high amount of revenue that is connected to medical necessity. And that would be $2.8 billion as of recent. And those RAC contractors have all four said that the top issue that is causing recoupment is medical necessity. So indeed, medical necessity is important, and understanding how to appropriately document medical necessity in a wound care center is important for you to know. And it is key to hanging on to your revenues. So, how about a diagnosis code and a treatment plan? That's typically what most providers feel that they have covered medical necessity if they can just make sure that they write down the correct diagnosis code that has been approved for treatment. But that alone is not going to do it. Your diagnosis code is indication, and your indication is the beginning foundation of towards medical necessity, but not alone. So go on further and detail the secondary problem that your patient has. Because remember, in an outpatient setting, your patients are coming to see you not so much because they have the condition of diabetes or maybe venous insufficiency, but they have a secondary problem. So that's what you want to further detail in your documentation, and connect the dots for the reader or the auditor to demonstrate that you have a full picture of why this patient's problem is related to their diagnosis, and then detail the case that you have at hand. And make sure that in your story that you're telling the auditor that you have a case that can support the payment that you are going to be billing for, because your documentation should be giving voice to the claim. We've all noticed an increasing demand for medical records. The data that's being required is growing, and it's not going to slow down. So certainly make sure you look at your payer policies and understand your utilization limitations, as well as when to issue an advanced beneficiary notice, and any caps that may be on certain procedures and devices. Like debridement. Debridement is one that is right now has usually a cap on all of the contractors. And so it's important to know when you are getting close to that number, or certainly if you were to go over that number. And that's when medical necessity definitely has to be clear in the medical record. A recent audit that we did from Enrich Services, we found where a patient had muscle debridement 39 times in the same wound. Well, certainly that type of case would indeed mean that the patient was probably in the wrong place of service and should have been as an inpatient. So if you haven't looked at a Medicare coverage decision policy, and especially your local, I would encourage you to do so. And there you'll see outlined for you what is supposed to be written down to clearly identify medical necessity. Use the payer's own verbiage when you document to ensure proper payment and that you won't have to pay the dollars back. Be proactive in your stance by understanding all of your policy requirements and not reactive. And make sure you self-audit yourself regularly and initiate a compliance program that's customized to the services that you provide, as well as also includes your physicians on staff and other clinicians. So hopefully have a better understanding about medical necessity now. And if you have any other further billing, coding, or compliance questions, I would encourage you to send them in to us here at Woundwire at info@woundwire.com, and we'll try to get to them next time.